Okay, ethics is easy points on step 2, so pay attention. Today we're going to talk about communication and counseling. The purpose of counseling is to provide a human being some advice, information, and you assist them in improving their health. And this can be either through treatment or through quality of life changes. You always want to pick answers that show a lot of empathy, interest in the patient, or a continuity of care, such as follow-up care. There's an approach called the patient-centered approach, and the whole purpose of this is to have shared decision-making between you as the physician and the patient. When it comes to patients with chronic conditions, you want to kind of focus on multiple management strategies such as pain management and the therapy itself. No matter what, if anywhere in the STEM they talk about the patient's priorities, you always want to select treatments that cater towards them. Pick answers that show that you actively listen to the patient and always use answers that are open-ended questions if they are available. For example, you do not want to ask something like, is it a sharp pain? Instead, you want to ask something more open-ended. Can you explain to me what it feels like? When a patient comes in for a very specific reason in the prompt, for example, someone with very high triglyceride levels, you want to be able to ask open-ended questions and still the answer remains the same. You want to pick a question that is more open-ended. For example, you do not want to ask something like, why do you think your triglyceride levels are high? Instead, you should ask something like, how do you think your condition has caused any difficulties in your life? Lastly, it's very important to know if the patient has any barriers to their care. Let me give you some quick spark notes for some of these ethical questions. You want to pick answers that reassure the patient that you know their collaborative goals and you want to offer them resources. Definitely look at answers that are empathetic. However, this is not always the right answer. Just because you're picking an empathetic answer does not mean that you're fully supporting the patient and their treatment goals. If a patient has been waiting a long time in your waiting room, you definitely have to apologize and you just continue your care. If it's very difficult for a patient to often show up to these appointments, always respect them and commend them for what they have done. For example, attending a doctor's appointment when they're incredibly busy and also remaining optimistic when they have a poor diagnosis. Just like with empathy, it's very important to validate and acknowledge your patient's emotions. And lastly, always offer them support and follow-up care.